it's actually more sustainable for them as well. We do see a lot of market expansion with our products. So we're starting out in the neonatal space, but we do think that a vital signs monitor is important for pediatric surgical applications, disaster relief, and even in the US market. So we're looking at several different funding models for that.
So project I see, the beauty of our project is that our focus population is people with low vision, and the low vision market is not a penetrated market like the blind community. For the blind, there are a lot of products out there. However, for people with low vision who have some useful remaining vision, there aren't so many products. So how are we going to be sustainable? The vision enhancement component of our project is going to be free. However, the vision rehab, which is the long-term component of our project, which right now requires patients to visit clinics multiple times a year, that's going to be based on subscription to our application. Our customers are not necessarily people with low vision. Our customers also include schools for low vision, as well as low vision experts, those who perform low vision rehab. And you are aware of all the costs associated with visiting clinics. And once those visits are not required, patients can save money, doctors can save time and money, and the subscription fee is not a prohibitive amount. It's going to be a small amount, but it's going to be a long-term process because they need to do vision rehab multiple times a year.
So unlike some of the other technologies, we're fairly early, but I can speculate a bit. The in-home market is one major area where we're really interested in. A lot of apartment complexes and housing units, for example, are required to be checked for internal air quality by cities, in the United States at least. And I'm sure that such a policy would be very useful abroad as well. And that would be one application area where instead of taking samples, sending it to a lab, and waiting weeks to get a result would be something much easier to do with a portable system like this. And of course, the other applications, urban testing and things like that, are also other potential opportunities that we're looking into right now. And I think for defense and security applications, this is also another interesting approach, because if you can identify all the different types of biological contaminants inside of your air on a local urban scale, that would be very interesting to the government.
Thank you very much. Any questions from? Okay, well, I have another one myself to whomever wants to go first. Innovation is a tricky thing, and I'm sure that you've all gone through a process to arrive at your solution. But you must have run into some obstacles down there. So will you give us an example of an obstacle you ran into and how you were able to overcome that? That'd be terrific. Who wants to go first?
I can start on this side, I guess. We'll go the opposite direction. So the development of this particular device has actually been quite a long and windy, twisted road. When we first started, we had this idea 2 years ago, actually. And it's only really been the last year that we've really come together with the development and conceptualization of the current version of the device. And we started off with a lot of different ideas of how to go about tackling this air quality problem, especially using our computational microscopy technology. But I think the biggest thing that we've continuously realized is, what is the need in the market for air quality monitoring? And at the very beginning, we were developing solutions that obviously were not going to meet those needs. And it was only later when we started talking to people that we started to realize, the direction we need to go in is a portable, very small, compact, ideally wireless or connected to a smartphone or other type of cellular device that would be able to do this type of monitoring. And one recent thing that we've realized is our current cartridge-based system is not very, appealing to many people because of the fact that we're using a cartridge that needs to be replaced fairly often. And so now we've actually just taken a step back and we're redoing our initial design to make it a continuous monitoring system. So in regards to innovation, it's been a lot of feedback from the people in the market that's kind of driven the way that we've taken our approaches, and it's made us change a lot of directional changes.
So with our solution, I see the basic idea behind it is fairly simple. There were a lot of bells and whistles. Some of them turned out to be not bells and whistles exactly. Later we realized we actually need them. One was energy efficiency, which at the beginning we thought to ourselves, what's going to happen, after a few hours the system is going to die. Worst case scenario, the subject is going to carry a portable charger with him or her. However, we realized that would not suffice. So we decided to make our algorithms, image processing algorithms, more energy efficient. We made basically the system context aware to some extent so that the system realizes itself in what environment it's being used. And this problem of energy efficiency, it was a roadblock before, but now it's one of our innovations, how we designed energy efficient, context aware image processing, video processing algorithms. And I believe a couple of other projects, at least, they need this technology as well to make their product last longer and need less number of recharges every day.
So working with babies in low resource settings, there are a number of different design constraints that we were faced with initially. Two of them that I'll talk about briefly is one is size. Premature babies, I don't know if you've seen them, but they're extremely, extremely small. So a wearable device that fits on a newborn's head has to be really tiny. And then the second consideration is power and being able to last for long enough in hospitals that don't necessarily have power, at least not continuous. So for size, we just got back from Uganda about a month ago, and even the size that we're at right now is still too big. However, we do think that it's small enough that we can test our accuracy of our device first, and then we're looking at ways to optimize the size a little bit more. So for example, we use reflectance pulse oximetry in our technology, and we need to actually observe the waveforms for that. But once we have validated our accuracy, we don't need to see the waveforms. So in our current device, we have additional memory and SD card that stores that waveform, and in our next version of the device, it won't have that. So that's one way that we can reduce the size of our device. It is something that we're constantly battling with, because when you try to decrease the size, that means increase in cost for development. So it is something that we're constantly dealing with. And then for the power considerations, looking at batteries that are also small enough to fit in a device that fits on a baby's forehead, that's really tough. And right now we've been able to accomplish a 5-day battery life, which is about the lengthest day of a baby in a hospital. So that's what we're looking at for now, but of course working on optimizing that in the future as well.
Okay, let's move over to the side of the table.
Yeah, so I think for us, the biggest early innovation, or biggest early thing that we learned was making the transition from thinking we could ever just make a single water meter and have it be cost effective. Because the cost just was not, it didn't matter if the parts were free, that wasn't where the cost was. We didn't have the resources to pay the engineering staff we would need in order to actually make it robust enough to last for 10 years in the field in a harsh environment to be useful for end customers. So really our whole approach is how do we, given that, what parts of this technology are usable in which other settings, such that we can use those to then do the R&D for those applications and reuse it for this application. So it's all about figuring out what the actual sort of barriers were that were preventing this technology from getting into NPO's hands earlier. Realizing that it came into design costs and very high design costs for long-term monitoring devices, and then figuring out ways to break that down once we understand each one.
Yeah, Working in the health space, one of the most striking things that we discovered is that there's a very big gap between the recommended medical guidelines and the gold standard equipment and what actually is the practice on the ground. So oftentimes the equipment and the practices that are recommended are not followed at all in the rural areas or in the rural clinics. So that requires us to have to pivot. So one example is in pulmonary disease. So the gold standard for diagnosing COPD is a spirometer. And there's maybe 50 different groups doing mobile spirometry on a phone. But if you go to the field, you see that no one uses a spirometer because it's very difficult to use for kids and for elderly people, and you need training to be able to administer the test. So that's why we pivoted to using the peak flow meter. So things like that happen all the time. You have to just observe, see what's actually being used, and then design around it. And then the last comment I'll make is that on the private clinic side, working with doctors over the last 15 years or so, we discovered that a doctor will not use your device unless A, it saves them time, or B, it allows them to charge more money. So that's the other observation. Thank you.
Thanks. So working in the wastewater space, one of the big things we realized early on is that fouling of your treatment technology is a huge problem and can lead to increased costs like you wouldn't believe. So we really realized that what's even more important than building the best possible, in our case, catalyst for treating wastewater, is to make something that's resistant to the highly corrosive environment and disgusting environment that is treating raw human waste. So we were able to focus our research efforts on developing a new chlorine evolution catalyst that allowed for increased durability, which actually allowed us to reduce our costs even more than the traditional, the industry standard, which is to increase activity. So that's something that we took across the development world.
Well, thank you very much, all of you. We are officially out of time, and it looks like lunch has been rolled in, so we need to transition to that.